Welcome back to CBS This Morning. As you may have noticed, today is National Wear Red Day. It's a day when we're all encouraged to wear red to help raise awareness for women's heart health. Cardiovascular disease is the #1 killer of women in the U.S. The disease affects about 44 million. An alarming new survey by the Cleveland Clinic found coronavirus concerns are preventing some heart disease patients from going to the doctor. CBS News senior medical correspondent Dr. Tara Narula joins us now. She's a cardiologist and spokesperson for the American Heart Association. Tara, good morning. Thanks for being here.
Anthony, she's wearing red.
Is she wearing red?
Yeah,
Tony's wearing red. We're all wearing red.
Yes, I am.
Tara, the numbers we just mentioned really are alarming. What do women need to know about this disease?
Well, Anthony, the famous Chinese military leader wrote in The Art of War, know your enemy and know yourself. So one word, awareness. That is how we're going to win this battle. Women need to understand this is their biggest health threat. So if every woman, whoever's listening this morning, put down your coffee, stop what you're doing, and remember these 3 things. Cardiovascular disease kills 1 woman every 80 seconds in this country. It kills more women than all forms of cancer combined, and it is the leading cause of maternal mortality. This is a disease that affects women of all ages, all backgrounds. So the same way that it's ingrained in women to get her pap smear or her mammogram, we need to start to have women understand that they need to know their cardiovascular risk and have a discussion with their doctor, starting early.
What are the risk factors for women, Tara?
Well, there's certainly the traditional ones that you've heard about. So hypertension, high cholesterol, obesity, diabetes, smoking, alcohol, family history. But then there's ones that many women don't often think about. So early menopause, migraine, polycystic ovarian syndrome, lupus, rheumatoid arthritis, depression, anxiety, and finally a really important one, things that happen to a woman during pregnancy. So gestational hypertension or diabetes, preterm delivery, preeclampsia. All of those things are going to raise her risk. So a woman should start being screened at age 20. She should know her numbers, and by those we mean blood pressure, cholesterol, body mass index, and blood sugar, and she should know her family history.
Boy, Tara, you sort of answered the question. I was going to ask you what age 20 seems so young. And does it matter if you have heart history, bad heart history in your family? I'm surprised by the 20 number.
No,
that seems young.
Yeah, I think what's so surprising to people and what we try to educate them about is that the seeds of cardiovascular disease are planted so early, and so much of it can be silent until the day that you have your heart attack or your stroke. But that disease process is starting at a very early age.
Tara, why do you think so many women ignore symptoms when they get them?
I want to know, what are the symptoms?
Well, so I can answer both. Symptoms, obviously most common is chest pain, pressure, burning, squeezing. But certainly women can also have shortness of breath, decreased exercise tolerance, fatigue, nausea, lightheadedness, passing out, jaw pain, arm pain, back pain. All of those, if they're new or they're concerning, should signal a woman to speak up and talk to her doctor. And as far as why they ignore them, I think they may not recognize that could be signs or symptoms of cardiovascular disease, but also women tend to not prioritize their health, particularly their heart health, and they downplay things. They prioritize their children, their work, everything else. So we need to have women move themselves up to the top of the list. But one other important thing, Anthony and Gayle, is that as a medical community, we also downplay. We know that if a woman arrives at the hospital, she's going to wait longer than a man to be seen for chest pain. Less often, she's going to get aspirin or guideline-directed medical therapy or diagnostic testing. This is a big problem. I have a lot of patients telling me, my doctor told me I'm just anxious, I'm just stressed out, when in fact they have a real problem. So awareness needs to happen on both sides.
Yeah, and women need to keep speaking up and pay attention to your bodies. Thank you very much, Tara. Always good to see you.